And while we're having some people come back together, it's perfect. We can get a few of these things going. So this is my autonomic nervous system presentation. How are we feeling? Do you want me to keep talking, or do you want me to play videos too and talk? What do we think? Do we want videos and me talking, or just me talking and you can watch videos on your own? It's up to you all. Watch videos on your own. Great. Okay. Online, do we have any votes?
Same. Videos on.
Videos on. Great. Okay. Perfect. That is what I was hoping for. Just me talking. Great. You're not sick of my voice yet. I am so sorry for all of you. All right. So we're going to skip that. I put in the crash course videos for the ANS. There's 2 of them in here, one for sympathetic, one for parasympathetic. They do a good job of like a good brief overview of all the key players. So if it's something that you need to not actively study, I suggest playing those videos in the background because it's good review, honestly. So overview of our autonomic nervous system. This is our motor system for our visceral organs, our blood vessels, and our secretory glands. Just making sure good. We're going to be dealing with cell bodies of pre-ganglionic axons located in the brainstem or spinal cord. So if we're located in brainstem or spinal cord, that's coming from our central nervous system to our peripheral nervous system, right? Autonomic nervous system is in our peripheral nervous system. That's again what I want you to remember. ANS, peripheral. Our axons of these visceral motor neurons are thinly myelinated. They project to our autonomic ganglia. The cell bodies of our postganglionic neuron is located within the autonomic ganglia, ganglia being a cluster of neurons in the peripheral nervous system. We then have unmyelinated axons that project to our visceral effector cell. We'll look at what that looks like here in a minute. But let's look first at some organization, some breakdown. I do have a picture coming up. So when we look at the sympathetic versus parasympathetic, these are the 2 branches of your autonomic nervous system. The sympathetic, our ganglia are located closer to our spinal cord. For our parasympathetic, the ganglia are located closer to your effector tissues or organs. The organs or the tissues that you're going to be sending the signal to. This means that the sympathetic is going to have a quicker response from the central nervous system to your ganglia. Versus parasympathetic, once it gets to your ganglia, it's going to have a quicker response to the effector tissues. It's just time of travel. And we'll talk about pre and post synaptic neurons and length here in a minute. Your sympathetic neurons are coming from the thoracolumbar region, so thoracic and lumbar region. So if you had a thoracic or lumbar pathology or issue in that region, what part of the central or the autonomic nervous system could it affect? Be your sympathetic, if it's thoracic and lumbar. Versus if it's parasympathetic, it's craniosacral and sacral. Because of where the ganglia are located, we're going to have short preganglionic fibers for the sympathetic nervous system because the ganglia for our nervous system, our sympathetic nervous system, are closer to the spinal cord. We're therefore going to have long post-ganglionic fibers. So our fibers from our ganglia to the effector organs are long. That makes logical sense. This answer, though, gets confused. Like people will miss it every time. So it's one that you just got to stick in your brain and remember. For parasympathetic, you're going to have then long preganglionic fibers. So from the cervical to the sacral neuron bodies, you're going to have a long preganglionic fiber, ganglia, and a short postganglionic fiber. So what does that look like here in a picture form, what I just talked about? So you can see up top, we have our parasympathetics from our cervicals. And then this isn't actually like a good representation of where these are located, but these in theory, our ganglia are far away. And then they're closer to things like the eye and the heart and some of the bronchi. We then are also going to have parasympathetic ganglia down here from our sacral region, which is going to hit genitalia, bladder, urethra, anal sphincter, and some digestive processes. And then we have our sympathetic ganglia here in the middle, sympathetic in the middle from our thoracic and lumbar regions, which is going to go to the celiac ganglia, the superior mesenteric, aortorenal, and our inferior mesenteric, which are going to hit stomach and pancreas and intestines, et cetera, et cetera. Of course, we know that we also have some sympathetic that innervates the heart and the bronchioles. You can see that here, heart and bronchioles. And some sympathetic that can also go down here into your colon and your bladder. So a lot of them can hit both. We're going to zoom in then onto what's actually happening from a small scale, big scale to small scale, and look at the physiologic anatomy of the sympathetic system. So we have taken a slice here of our spinal cord. You can see here that leaving the spinal cord, these are preganglionic neurons in red. We are going to go through the ventral root. We're going to pass around through this circle. This is a spinal nerve here, pass around through this circle through a white rami, and we're going to synapse with our postganglionic neuron. I'll do that in another color. We'll just follow each of these pathways. Synapse with a postganglionic neuron that's also going to travel out of our spinal nerve. We then can also have that same process, that same pathway we started with. Oops, sorry, I'm getting back to my color. Same pathway we started with, out of the ventral root, down through a spinal nerve. And instead of synapsing with our postganglionic, we can have it travel directly up or down the sympathetic chain here. It travels down the sympathetic chain. It can also synapse down here with a different spinal nerve at a different level. And we have a postganglionic neuron. This is again, sympathetic system. Okay, so close to the spinal cord. And lastly, you can have here, you could have it go over here, and peripheral ganglion is going to synapse again with our postsynaptic ganglia, postsynaptic neuron. And then this is showing our actual effector organ here. This is being a gut. And our postganglionic neuron is synapsing at the gut. We can also have sensory input, sensory endings, sensory input from the gut, send up through a peripheral ganglion, send through a white rami, coming up the spinal nerve, through the dorsal root, and directly into our spinal cord. So if you're having trouble with pathways at the actual like central nervous system level, this is probably going to be the most simplistic picture that you can commit to memory to help you remember ventral root, dorsal root, what is coming. Ventral root signal leaving the spinal column. Dorsal root typically signal coming back. Okay. Dorsal root's also associated with our motor contraction a lot of the time. But in this situation, we're talking about sympathetic nervous system. So our signal is going to come through our dorsal root to our spinal cord. It's going to leave through the ventral root from our spinal cord. It can synapse within the sympathetic chain. It can synapse at peripheral ganglia. And then it's going to travel either out spinal nerves or out through the peripheral ganglia to our effector organ. Word-wise, again, sympathetic nervous system, we're dealing with thoracic and lumbar. Axons can go one of three paths. That can enter our sympathetic chain via our white rami, white ramus, and terminate there. So this is option one. It can enter our sympathetic chain via the white ramus and ascend or descend a few segments before terminating. So it can go up or down. This could be option two. And then it can enter via the white ramus and exit via the splanchnic nerve and terminate in a prevertebral ganglia. And this would be option three. Either way, it's leaving through that ventral root from the spinal cord, that signal. Sensory is coming in through that dorsal root. So some characteristics then of sympathetic function. Our nerves in the sympathetic nervous system are going to be releasing norepinephrine at their nerve endings. Nerves are then called adrenergic nerves. So sympathetic, adrenergic nerves, nerves again being in peripheral nervous system, release norepinephrine at the end. But all preganglionic sympathetic nerves release acetylcholine. This is for the sympathetic and parasympathetic system. So if we think about it, we have a signal from our spinal cord here. It's going to travel from the spinal cord and it's going to synapse with a new nerve. This is our new nerve. Woo. And then it's going to go down here and it's going to synapse with its effector organ. Okay, that's our effector organ. This is the best drawing you're going to get. Beautiful. At this first synapse, our preganglionic synapse, all preganglionic sympathetic nerves are releasing acetylcholine. So where's my little pointer? Okay, there we go. Here, acetylcholine is your neurotransmitter that's being released. at your preganglionic sympathetic nerves. Then once we get to our end tissue, that is when norepinephrine is released for whatever action the sympathetic nervous system is taking. This is a super easy way to be tricked on an autonomic nervous system question. Because they could say, they won't do a true or false, but they could do something to the effect of at sympathetic preganglionic nerve endings, are you going to see acetylcholine release, norepinephrine release, or they could combine it, right? They could do preganglionic acetylcholine, preganglionic norepinephrine, postganglionic acetylcholine, postganglionic dopamine, right? They could throw in another random neurotransmitter. You're looking for what's the correct matchup. So for our sympathetic nervous system, at our preganglionic synapse, it's going to release acetylcholine. That's then going to send a signal down our postganglionic nerve from our neuron, our body, down the axon to our next terminus, which is at the effector organ. And at the effector organ, where it matters, where the signal is actually going to take action, that's when the sympathetic nervous system releases norepinephrine, that catecholamine. And those nerves are called adrenergic nerves. So in the sympathetic nervous system, almost all postganglionic sympathetic nerves release norepinephrine. The ones that don't are sweat glands, piloerector muscles, and certain blood vessels. But when in doubt, I would say if you're studying, sympathetic nervous system releases norepinephrine. That's your neurotransmitter of choice. The synthesis of norepinephrine, tyrosine leads to dopa, leads to dopamine, leads to norepi, leads to epi. That's your synthesis. Versus acetylcholine, like we mentioned before, is your combo of acetyl-CoA and choline itself. And so anything upstream from norepinephrine or epinephrine, if you have a deficiency in dopamine, or if you have an issue with dopa or an issue with tyrosine, it can affect your production of those two catecholamines, those two neurotransmitters, which then could change your sympathetic function. That's a common question as well, both NPLEX 1 and NPLEX 2, actually. Yeah. Adrenergic nerves release norepi and epi, yes. Thank you, Ashanti. Yep. Our sympathetic nervous system and receptors. So again, sympathetic nerves release norepinephrine. Norepinephrine is going to stimulate alpha or beta adrenergic receptors, right? They're adrenergic nerves. So it's going to stimulate alpha or beta adrenergic receptors. Alpha receptors are typically located on blood vessels, and they are going to stimulate vasoconstriction. Okay, this is not a perfect system. It's not all, but it's typical. Typically, alpha receptors on blood vessels, vasoconstriction. Beta receptors are going to be divided into beta 1 and beta 2 receptors. Activation of beta 1 receptors are local to the heart. So it's going to focus on heart rate increasing and increasing contractility or strength. Beta 1, think the heart. Beta 2, you think bronchial dilation, so involved in the lungs. Also dilation of blood vessels and skeletal muscles. So there is some dilation with sympathetic nervous system. Increase in calorigenesis and increase in glycogenolysis. So essentially, we're going to be increasing our body's ability to have fast resources, fast glucose available. We're not being storing, we're using. We're going to increase metabolic rate and use because we're increasing heart rate and contractility. We're increasing oxygenation by dilating our lungs, increasing bronchial dilation, and we're increasing blood flow to muscles so we can run, right? We can run from that bear. We're not increasing blood flow everywhere. It's localized to skeletal tissue because we're trying to increase oxygenation to those muscles for a short gain, right? Increased oxygenation and stuff to our contracting skeletal muscles so we can do whatever we need to do for a short amount of time. Fight off a bear, run from a whatever, take an NPLEX exam. We'll have some sympathetic input there. Absolutely. So again, if you're visual like me, this is showing parasympathetic and sympathetic. So we've looked at sympathetic first. So we have our sympathetic nervous system. We have our initial neuron that's going to then be sent out. We have their myelinated here. We can see with some gaps between. Since these are myelinated in the peripheral nervous system, it's going to be myelinated by Schwann cells, right? We then have our synapses here. We'll look at this one first. We have our synapse, initially our preganglionic, where we have acetylcholine. Then we have our neurons sending down a signal via our axon, and we have our postsynaptic axon synapse, which is norepinephrine at our organ. Another interesting function the sympathetic nervous system can do is it doesn't have to go down axons. It can go directly into our blood circulation, which is why a sympathetic response is typically faster acting than a parasympathetic response. Sympathetic response can go through the normal 2-neuron process, or it can go directly from our neuron cell initially down our axon, synapse with acetylcholine here to our adrenal medulla. This is what this is representing, is the adrenal medulla, which then can release norepinephrine and other hormones or chemicals or neurotransmitters directly into the bloodstream. So you can think of the adrenal medulla as an organ of the sympathetic nervous system. You can also think about it as an organ of the endocrine system, right? Because it can release hormones or it can release neurotransmitters. And if we remember, norepinephrine can be used as a hormone or a neurotransmitter, depending on what it's doing, right? So in this instance, when it's getting directly released to blood and it's not binding in a synapse, you would consider norepinephrine being used as a hormone. Versus when norepinephrine is binding to a receptor and dealing with a synapse, you think of it as being a neurotransmitter. It causes the same effects, okay? One's just going into the bloodstream, one's just being affected at that organ. And then we will talk about parasympathetic next. That's your sympathetic nervous system at its base. Again, another video. We're going to pass through it, and we're going to move directly into parasympathetics. The parasympathetic nervous system, we remember it because it comes from our cranial nerve roots and our sacral nerve roots. So it's gonna not be, or not cranial, but cervical and our cranial. Yeah, absolutely, cranial and sacral. It's going to skip this thoracic lumbar, cranial or cervical, but cranial and sacral. It's gonna skip the whole thoracolumbar. Thoracolumbar being sympathetic. I'm going to erase my weird drawings now. Maybe. Okay, I can't erase that. Oh, it's erased on your screen, but not on mine. Okay, that's fine. So we're dealing with our cranial up here and our sacral down here. Preganglionic neurons are blue. They're a lot longer in the parasympathetic nervous system because our postganglionic neurons are short. That means our ganglia, our peripheral nervous system ganglia, where we have our synapse between our preganglionic neuron and our post, is going to be occurring close to the target tissue. So the initial signal from either the cranial nerves or from the sacral nerves is going to take longer, but then once it gets to those effector organs, that action is going to happen quicker. Cranial nerves that you need to know for the parasympathetic nervous system is here. Let me erase this so you can actually see it, and then I'll get to your question. Yeah. Yep. So cranial nerves, I read your mind. 3, 7, 9, and 10. We're going to talk cranial nerves in our last section today, and we'll go through all of them and their functions, their names, etc., where they are, etc., where they flow through the little holes, all that good stuff. But 3, 7, 9, and 10 are your cranial nerves associated with the parasympathetic nervous system. 10, the vagus nerve being the most important, but all 4 of them are associated with the parasympathetic nervous system. It's important to know. 3, mainly focusing on our ciliary muscles and pupillary sphincter, so being able to vasoconstrictor dilate our eyes, right? 7, associated with more of our glands, and also a little bit with submandibular ganglion, so digestion, mastication, saliva, right? Because we're thinking digestion for parasympathetic. 9, more of our otic ganglion, so some of our other sensations, so being able to hear, or also parotid glands, so other components of digestion. And then 10, everything: heart, stomach, pylorus, colon, small intestine. And then down below, our sacrals are more associated with what we would think of: anal sphincter, urinary things, and our genitalia. So the sacral ones are more associated with the organs in that pelvis region. The vagus nerve is really the big viscera, the heart, and the digestive tract. So when we look at anatomy of the parasympathetic nervous system, we are looking at Again, our visceral motor neurons located at that brainstem nuclei and sacral segments 2 through 4, parasympathetic nerves from our cranial nerves, so 3, 7, 9, and 10, as well as our sacral spinal cord. So 3 being our oculomotor nerve, fibers to the pupillary sphincters and ciliary muscle, like we talked about, facial nerve being 7, nasal, lacrimal, and submandibular glands. 9 being our glossopharyngeal nerve, fibers to our parotid gland. There's other functions, right? But these are the parasympathetic functions or parasympathetic actions we're talking about. And vagus nerve, motor input to visceral organs. Our sacral segments, like I mentioned, fibers to descending colon, rectum, bladder, and genitalia. So what did they release? Acetylcholine. They release them at both places. Great, easy. Preganglionic and postganglionic nerves both release acetylcholine. So the one that doesn't release acetylcholine is our postganglionic nerves of our sympathetic nervous system. And this should say parasympathetic. So para, here we're talking about the parasympathetic nervous system, and para again. These nerves are called cholinergic nerves. How do I remember that? Because it's acetylcholine. They release their cholinergic nerves versus adrenergic nerves in your sympathetic nervous system. Parasympathetic cholinergic nerves only release acetylcholine. Parasympathetic, again, sorry, this is just like continuously haunting me here. So our parasympathetic nervous system and receptors. So the parasympathetic nerves release acetylcholine at both its places, pre and postganglionic. Acetylcholine is going to stimulate both nicotinic and muscarinic receptors. What's that? Yikes. So nicotinic receptors are located in our synapses between our pre and postganglionic neurons and at the neuromuscular junction, versus the muscarinic receptors are located on all effector cells stimulated by postganglionic parasympathetic fibers. So muscarinic receptors located on effector cells that are stimulated, so that the end receptor. Think about it, at your end organs is when your muscarinic receptors are located, versus your initial synapse is where you're going to have nicotinic receptors. Now, my next question I get is, can you have nicotinic receptors in your sympathetic nervous system? What do we think? Yeah, yes, because our nicotinic receptors are occurring between our pre and postganglionic neurons, and they're binding to what? Acetylcholine. What's released in the sympathetic nervous system between the pre and postganglia? Acetylcholine. So they are going to look pretty much identical at the pre and post synaptic synapse, pre and post synapse, right? Preganglia and postganglia. They're both going to be nicotinic receptors that bind to acetylcholine. The difference is the location of those receptors, how close they are to the spinal column. Sympathetic, pre and post ganglia, the initial is going to occur close to the spinal cord, versus parasympathetic, close to the effector organs. Then once you get to the effector organs, that's when they differ. You're going to have adrenergic receptors associated with norepinephrine binding in your sympathetic nervous system, which is why they're called adrenergic nerves. And then you're going to have muscarinic receptors associated with your cholinergic nerves of the parasympathetic nervous system that bind acetylcholine. That's when these words and terms kind of can get confusing. But the beauty of the parasympathetic nervous system is it's only acetylcholine all the time. It's your only neurotransmitter you need to worry about. Yes. And then it varies sympathetic. Yes. Yes. Correct. Yep. Absolutely. The big difference between the presynaptic parasympathetic and presynaptic sympathetic is location of that initial ganglionic synapse. That's where you separate it in your brain. Yeah. And I say it twice because it's so important, right? I wouldn't say it twice if it isn't probably going to come up on a test question here or there. So here you have our parasympathetic, that same picture we've seen. You see our preganglionic axon. We see our preganglionic synapse. We see acetylcholine attaching to those nicotinic receptors would be here. Then our postganglionic axon is going to be right next to that effector organ, and we see our muscarinic receptors attaching to, again, acetylcholine. So if you had to look at one picture, this might be a good one. Just label your receptors, nicotinic, nicotinic, versus muscarinic and adrenergic. Again, video, if you're into that. All right, so how do things get controlled? So we're going to talk a little bit about autonomic control centers in the brain. Should you memorize all of these areas? No. If you know these areas, great, right? So if you already know them, awesome. It can help with maybe one question. Is it worth putting in your brain now, this close to the NPlex? Probably not. Big pieces to know. So parasympathetic control is going to be kind of over in this region here. Sympathetic control is right here. They're located very close to each other. Again, what is this? This is the hypothalamus. So hypothalamus, large big portion of control of our autonomic nervous system. Here for our ideas, pituitary gland here. And then you can see in your pons and medulla, you can start seeing these different specific control areas. We remember pneumotaxic center when we talked about the lungs, close to the urinary bladder center, cardiac center is down here, cardiac slowing, and then our other respiratory center we talked about, all in this pons and medullary area. But if you have to know one thing from this picture is know that hypothalamus is directly involved in control of your parasympathetic and sympathetic system. These are showing our receptors here. So again, if you like to see it visually, our sympathetic and parasympathetic preganglionic neuron, nicotinic receptors, postganglionic neuron, adrenergic, and muscarinic. So now I want to get into effects. So we're going to go through kind of different portions, organs of the body, and what their parasympathetic versus sympathetic effects are. So the eye, sympathetic, we're going to have pupillary dilation. Our eye's going to dilate, versus parasympathetic, we're going to have pupillary constriction. This allows for accommodation or focusing. The opposite of what we think of. So the eye, I always think of opposite of what I want it to be. I always want everything in the sympathetic nervous system to constrict. It's the opposite with the eye, dilates. In the glands, our sympathetic nervous system stimulates our sweat glands, versus parasympathetic can stimulate pretty much every other gland, right? Nasal, lacrimal, salivary, GI. Reason we have sweat gland stimulation for sympathetic is to really allow us to release some of the heat that's being generated from our increased metabolic rate, from us trying to allow for glucose availability at our different skeletal muscle cells and our heart rate that's beating faster and the oxygen that we need. So that's why sweat gland stimulation happens in the sympathetic side for heat temperature balance. The GI tract, the sympathetic nervous system, has little or no direct effect, but the parasympathetic nervous system is going to stimulate the GI tract. So the sympathetic nervous system does not necessarily directly inhibit the GI tract. The parasympathetic is going to stimulate it though. So that's a big kind of piece of the puzzle to remember. The heart, sympathetic is going to increase our heart rate and contractility, versus parasympathetic is decreasing heart rate. But if we remember, parasympathetic fibers are not really innervated in the ventricles, so it doesn't decrease contractility. It doesn't really affect contractility. It is going to slow down heart rate through our conduction center, through our SI node. Blood vessels, we're going to have vasoconstriction of the majority of our blood vessels, although we will have vasodilation in skeletal muscle for sympathetic. Overall, parasympathetic, we're going to have some vasodilation, but it doesn't have a lot of effect on our actual blood vessels, parasympathetics. Mild vasodilation, but not a lot. If you had to choose one, I would say sympathetic is going to exert the most control over blood vessels. So what does the adrenal medulla do with the ANS? We talked about this a little bit. You could consider it as a huge sympathetic ganglia. When stimulated, it can release 80% norepinephrine or 80% epinephrine and about 20% norepinephrine. It can cause prolonged activity of these substances versus shortened for the neurotransmitters at the synapses. This can stimulate cardiovascular function and metabolic rate for a longer period of time. It also helps the body deal with its stress response, which is why we can see side effects of sympathetic stimulation for a long period of time in someone who has chronic stress, specifically with the heart and metabolic rate. Our tone of our autonomic nervous system is kind of that basal rate, that background activity. Sympathetic tone overall causes about 50% of vasoconstriction in the body. So if you think about the body's ability to vasoconstrict, our sympathetic tone at baseline causes about 50% constriction of the blood vessels. So that's its baseline layer. Means it could vasodilate 50% more, or it could vasoconstrict even more, 50%, if we need to up or decrease our sympathetic input. But at baseline, all of our blood vessels are about halfway constricted due to sympathetic tone. Our parasympathetic tone provides some background gut activity. So again, the tone is kind of our balance, our baseline of what's happening in a normal balanced autonomic nervous system. All right, we're going to do a little review. Okay, so selective bilateral damage, the gray ramus from T1 through T6 would most likely produce which of the following effects? A lower than normal heart rate, bilaterally constricted pupils, an increase in intestinal motility, or all of the above. Again, think about what is the gray ramus? It's affecting T1 through T6, so what comes from there? And then what effect would you expect to have? Lower than normal heart rate, bilaterally constricted pupils, increase in intestinal motility. What might help you answer this is thinking about what's a lower normal heart rate? Is that a parasympathetic or sympathetic response? Para. What about constricted pupils? What about increase in intestinal motility? Para. So they're all parasympathetic. So then what must your answer be? All the above, right? They all are the same process. So if you had no idea how to answer that question, go through each one of these, say, okay, well, what system is this? Is it para or is it parasympathetic or sympathetic? They all were the same. So then you know it has to be all the above. So doesn't matter about the gray ramus at all. It matters that it's coming from T1 through T6. So it's T1 through T6 is what? What comes from our thoracic portion of our spine? What? Sympathetic. So if we damage the communication of our sympathetic nervous system to these specific organs, which T1 through T6 affects the heart, it can affect eyes, and it affects the gut, which we don't even have to know to answer this question. We just have to know thoracic is sympathetic. So if we damage the communication response of that sympathetic nervous system, we're going to see increased parasympathetic effects in those organs because we don't have sympathetic control. That's what that question's asking. So it makes you know two things. If you're really trying to answer the question based off of knowledge and just not off of elimination, if you know that in the thoracic and lumbar spine, that's where your sympathetic nerves are exiting from those nerve roots, then any damage to that region is going to decrease our sympathetic input. Therefore, our parasympathetic input is uncontrolled, right? It can allow parasympathetic input to run amok without sympathetic control to calm it down. Do you have a question? I love it. Yes? Yes. It is, right? The background tone is parasympathetic, but if you have unmatched parasympathetic control, so you have nothing that's going to decrease your parasympathetic response. So while the sympathetic nervous system doesn't directly affect intestinal motility, it does help balance parasympathetic input. So if you have no sympathetic control and parasympathetic input's the only input you have, anything that's parasympathetic is going to increase if you decrease sympathetic input. That's really what this question comes down to. But you're right. If this was a question almost in reverse, let's say you had parasympathetic damage and you were having sympathetic input, you wouldn't see a change in intestinal motility. You shouldn't from an increase in sympathetic input because sympathetic input has no effects directly on digestion, right? But if you think about that as it's going to inhibit any parasympathetic process, in theory, then you could say, well, anything that's parasympathetic is going to be inhibited, even though it's not directly affecting the gut. Does that kind of help change it in your brain? It is minutia, but they could absolutely minutia you on the test. They do that all the time, right? Yeah, it's like, what is this? This is the most specific, and that's why these questions are kind of purposely worded in this like weird and flexy way. So then, which of the following nerve fibers are contained in the gray ramus? Oof, now we actually have to care. Is it going to be post or pre-ganglionic? So that's our first question. And is it going to be sympathetic or parasympathetic fibers? So that's our second question that we have to answer. So post or post-ganglionic or pre-ganglionic? And then is it going to be sympathetic or parasympathetic? And I am pulling up my answers. I'm waiting for online people to answer too. Send it in the chat. Be brave, be bold. Don't be shy. Here we are, post-ganglionic sympathetic fibers. Why? What is the gray ramus? Okay, let's go back to our anatomy picture then. Let's pull it up. Discard my little. Okay. Current slide. All right, so we see here, this is our picture from the very beginning, right? I said if you had to learn one picture, don't know this one, right? So we see here, we have this is our spinal column. We have our ventral root, which then could go directly to our spinal nerve. And we then have the pathway is going to go stimuli, ventral root, spinal nerve to a white ramus, which then is going to go into our sympathetic chain, which this is going to be our preganglionic neuron. That's then going to synapse. Then we have the black thing going through is a postganglionic neuron that's synapsed in our sympathetic chain. So this postganglionic neuron goes through the gray ramus and then exits out through a spinal nerve to peripheral circulation. So again, this is our initial preganglionic nerve going into our sympathetic chain, our ganglia here. It's going to synapse, exit through the gray ramus right here, and then it's going to go into our peripheral circulation through a spinal nerve that then goes out and synapses to its effector organ. So gray ramus associated with the sympathetic nervous system, associated with postganglionic neuron of the sympathetic chain. Correct. Yes, the white ramus you could consider as preganglionic prior to it synapsing with that sympathetic chain. Perfect. Yes, correct. Now let's go into our current slide. Okay, here we go. We're back on track. At least we're back on the right slide. There we go. Pretty little answer. All right. Which of the following structures is innervated almost entirely by the sympathetic division, but not the parasympathetic division of the autonomic nervous system? So which one is innervated entirely by the sympathetic division, but not the parasympathetic division? If you had to choose. This is the opposite of what we want, because we want it to be what's innervated almost entirely by the parasympathetic division, and we choose the gut, right? That's not the case. So let's think about this. Are reproductive organs innervated by both? Yes. Is the heart innervated by both? Yes. Is the gastrointestinal tract innervated by both? Not really. But is it innervated more by the sympathetic or parasympathetic? So that wouldn't be our answer, because we're looking for something that's just the sympathetic, right? What about the bladder? Is it innervated by both? Yes. So what are we left with? Blood vessels. Our best answer. Does it have slight innervation by parasympathetic? Yes. But is it majorly sympathetic? Yes. It has the majority of innervation by the sympathetic nervous system. That's the best answer. This has been on NPLEX a couple times, this question. But if you process of elimination, you all got there, right? So you just have to allow yourself to sit with the discomfort of not initially knowing the answer. If you sit with that discomfort for a second and logically walk your way through, you can get to the right answer. But you do have to allow yourself that walkthrough process, which if you have no logic that day, then that's a rough day for you. Yes. That's when you have to really do like whatever you can to keep yourself grounded and keep your own sympathetic nervous system like out of the way, So you can allow your logical brain to do its job and maybe like sniff a little rosemary before. I think I smelled, well, there was like one part that I just couldn't get in my brain. I forget what it was, something. And I like, every time I studied that thing, I smelled rosemary to try to provide some memory recollection. And then right before the exam, I had this little like twig of rosemary and I like snuffed it before and then thought that that might have helped me. Did it help? I don't know. I passed. I don't think it was from my rosemary sniff, but it felt very naturopathic. So I was very proud of myself. Rosemary helps with short-term memory recollection. Okay, good old rosemary. All y'all are gonna carry rosemary, rosemary and lavender. I had like lavender to calm myself down and rosemary to be like, I got this. Yikes. Okay. Which of the following are correctly paired? Sympathetic stimulation and ejaculation, parasympathetic and increased heart rate, sympathetic and blood vessel dilation, parasympathetic and constriction of the coronary artery, parasympathetic and dilation of bronchi, and sympathetic and pupillary constriction. Which one is correctly paired? And we can walk through, or which of the following are correctly paired? Maybe, maybe not. Let's walk through and maybe see which ones are impaired. Okay, do we know this one? Are we sure about this one or not sure? We're not sure, maybe? Yeah, sympathetic and ejaculation. We don't know. Some people say true, some people say false. We're gonna skip this one. We're gonna go through the others. We're gonna say maybe we don't know. Okay. Parasympathetic and increased heart rate. Is that true? No, wrong. Sympathetic and blood vessel dilation. Is that true? No, wrong. Parasympathetic and constriction of coronary arteries. Is that true? No, also wrong. Parasympathetic and dilation of bronchi. No, because we know that sympathetic stimulation does dilation of bronchi and it does constriction of blood vessels. That's why if you have, if you take albuterol a lot of times, you can have dilation of bronchi and increased heart rate, right? They work in opposites. They're opposite communicators. So this one's wrong. And what about eyes? Sympathetic stimulation and pupillary constriction. No, we remember our eyes dilate and get really big when we have some type of like sympathetic input. So we are left with, this is the only answer left, and this is the correct pairing. Sympathetic stimulation is ejaculation. Again, logic got you through this. You knew all the other answers. You might not have known that sympathetic stimulation was ejaculation, but you knew the others were wrong. Why? Sympathetic stimulation signals ejaculation. It's the sympathetic buildup that leads to ejaculation versus a vasodilatory effect that leads to an erection. So vasodilation leads to blood flow, which can lead to an erection, allows those muscles to hold an erection in place, but it's sympathetic input that actually leads to ejaculation stimulus, which is why after ejaculation, typically an erection no longer is instated. If it is, then there's probably some problem going on. Between all of them? Oh, yes, yes. So with sympathetic stimulation, you're going to have increased contractility and increased heart rate, but you're going to have dilation of bronchi. In parasympathetic stimulation, you're going to have the opposite. You're going to have constriction of bronchi with parasympathetic and a lowered heart rate. And how I remember this is I remember what happens to the body when you have too much albuterol. And that's just clinically, I'm able to remember that because I've seen it clinically. If someone comes in and they're given a bunch of albuterol, it's going to dilate our bronchioles and allow more oxygen to come in. The side effect is tachycardia. That's how I remember it. I connect it to a pharmaceutical, which is unfair because this is not on your exam, but it's kept in my brain. But yeah, the ejaculation one is tricky. So again, remember, parasympathetic control of vasodilation is going to allow blood vessels to more blood flow. It's going to allow for an erection to occur. But ejaculation is sympathetic stimulation, which is why after ejaculation, you no longer have an erection. Unless if you've taken meds, which then there's other problems there. Okay. Selective destruction of the right superior cervical ganglia would result in which of the following? Oof, gross. Okay. So we have right superior cervical ganglia. So cervical up top. It's going to result in which of the following things? Are we going to have dilation or constriction? And is it going to be in the left eye or the right eye? So we have to recognize, are these effects going to affect the same side of the brain or the opposite side of the brain, right? Is it the same eye or opposite eye? And is it going, destruction in the cervical ganglia, is it going to do dilation or constriction? I think that was someone online that we heard. Just right superior cervical ganglia. Be reducing the sympathetic. Yes. Yep. Cranio, not cervical. Yep. I know. That's why this is on here, because it's craniosacral. I think of craniosacral, right? Like our beautiful therapy. That's super awesome. But cervical is not involved. Cervical doesn't need to play when we talk about this. Craniosacral. It's going to cause constriction of the pupil in the right eye. Okay, so it's going to be same side, right? Superior. I'll show a picture of what this thing is. So I'll put that on my little notes. I'm not going to do it now because I'll have to exit out of anything and we'll lose our place. But during our next break, I'll pop up where the right superior, I'm writing myself a note, cervical ganglia is and how it causes that constriction. The pupil on the right. Okay, I will pop that up during our break. We're almost done with this and then we'll go take a break. I'll pull that up and then we're going to do cranial nerves. All right, nicotinic receptors are found on which of the following nerve cells? Sympathetic ganglionic cells, parasympathetic effector cells, or sympathetic effector cells? Is it going to be sympathetic or parasympathetic? And is it going to be ganglionic or effector cells? Yes, absolutely. It's sympathetic ganglionic cells. It's also parasympathetic ganglionic cells. It's just ganglionic cells, right? Nicotinic receptors are at our ganglionic cells. Presynaptic neuron is going to release neurotransmitter that's going to interact with our nicotinic receptors on the ganglia, which then that's going to send down our postsynaptic nerve, which is going to send out whatever neurotransmitter that interacts with our effector cells, which could be muscarinic or adrenergic, depending on which system we're activating. Good, good. Okay. Which of the following neurotransmitters is in autonomic ganglia? Is it norepinephrine, epinephrine, dopamine, and acetylcholine? Which neurotransmitter is in autonomic ganglia? Autonomic, I didn't separate para and sympathetic. So it has to be the only one that's in both, which is going to be D, acetylcholine. Acetylcholine affects both sympathetic and parasympathetic, and it is at that nicotinic receptor in the ganglia. There's just so many good questions they can ask. That's why this is just an important section to know. Which of the following receptor types mediates an increase in heart rate and contractility? So what receptor type is specifically localized to the heart? Beta 1, beta 2, alpha 1, alpha 2. Oops, sorry, I gave it away. It's beta 1. I already played it, I think. Yeah, beta 1 receptors, sorry. I thought I was pushing my computer when I was pushing your else. Beta 1, the heart, beta 2 elsewhere, right? Alpha 1 more, or alpha 1, alpha 2 more associated with blood vessel vasoconstriction, although they can be located other places. They tend to ask beta 1 questions or beta 2 questions. They love those. Beta 2 to lungs and to other tissues involved in sympathetic stimulation. Yep, so beta 1, think just heart. Beta 2, anywhere else. And then alpha, more blood vessels. That's kind of how I separate those. Yeah, good. Which drug? You don't need to know drugs. So bye. Okay. You don't need to know treatments. That's fine. Okay. Which of the following receptors is found in both the sympathetic and parasympathetic ganglia? Another way of asking a question we asked earlier. What receptor is found in both? Dopaminergic, adrenergic, nicotinic, or muscarinic? It is nicotinic. Nicotinic at our ganglia, our presynaptic ganglia. At that synapse is nicotinic receptors binding to acetylcholine in both systems. And you need, this is a farm question, so you don't need to know. So I'm not going to ask it. Okay, I thought about it, but I'm not going to ask it. It's fine. Okay, which of the following best describes spinal cord location of cell bodies of the sympathetic preganglionic neurons. Oof. Okay, another anatomy question. Either you've known this or you don't know this. So spinal cord location of cell bodies of sympathetic preganglionic neurons. So this is prior to them exiting that spinal cord. Is it in the lateral horn, the dorsal horn, or the ventral horn? You have some, it is the lateral horn. So again, going back to that initial picture, looking at when it exits the spinal cord, where is it coming from? It comes from the lateral horn. Stimulation of alpha adrenergic receptors causes all of the things except for one. What's the one thing that it doesn't cause? Is it bronchoconstriction, pilomotor contraction, vasoconstriction? This one's kind of hard. Intestinal sphincter contraction or iris dilatation. Think about the one thing you know it probably isn't. Alpha adrenergic receptors. We know our beta ones is the heart, and we don't have any heart ones on here. But what did we say beta 2 was? Everything else, and specifically what organ? Yes, so which one is probably not associated with alpha then? Bronchoconstriction, and that is correct. Bronchoconstriction beta 2s. Yeah. Dilation, absolutely. Yeah, absolutely. Sympathetic stimulation, so another question kind of the same but different. Sympathetic stimulation causes all of the following except one. What is the exception? What does sympathetic stimulation not cause on this list? We talked about it earlier. Or you could do process of elimination. Which one is caused by parasympathetic or it's just not caused by sympathetic? So I think we've got it. Is D, REF D, erection, not sympathetic. Vasoconstriction, yes. Bronchodilation, yes. Pupillary dilation, yes. Ejaculation, yes. So it's not penile erection. They love throwing in male functional anatomy in the sympathetic nervous system. It confuses us all. All right. Parasympathetic stimulation causes all of the following except for one. What is the exception? So the opposite question now. What is not, this one is a kind of a trick question. But this is why it's on here. Parasympathetic, it's not really a trick, but we'll talk about it. Parasympathetic stimulation causes all of the following except one thing. What's the thing it does not cause? So again, we could go through process of elimination here if you're not sure. Does parasympathetic stimulation cause a decrease in heart rate? Yes. Does it cause pupillary constriction? Yes. Does it cause increased gut motility? Yes. Does it cause bronchoconstriction? Yes. So it does not cause relaxation of the gallbladder. So that is your process of elimination answer. This is a favorite one because you think of anything in the gut being stimulated by the parasympathetic nervous system, but the gallbladder itself being relaxed and allowed to not contracting, but the gallbladder relaxing is not actually stimulating digestion, right? The gallbladder contracting is what actually is going to increase our bile secretion. Gallbladder relaxation is going to do nothing of the sort. So that's why relaxation of gallbladder, not helpful. But they love asking those questions where it seems like, oh, well, parasympathetic is going to do everything for the gut. So it has to be true if it's a gut thing, not if it's not actually helping with digestion, right? That's your relaxation of the gallbladder. And that's it. Whew. Autonomic nervous system done. All right, it's 11:14. So I want us to take 6 minutes just to have a refresher, stand up, take a minute away from a computer screen. We'll come back at 11:20. We're going to go through cranial nerves and vascularity of the brain. I'm going to, while you're gone, actually, I'm going to just show a 2-minute, well, actually, I'll wait till you come back. When you come back, I'm going to show a 2-minute video of vascularity of the brain, and that's what I suggest you study from. Then we're going to get into cranial nerves, and we'll go through all the cranial nerves together, and that'll probably end our time for today. So take 6 minutes, so 11:21.
Dr. Petshow?
There'll be, there's 2 links on the middle page, one that's a vascularity video, and the other one is actually a link to a website that goes through cranial nerves. So we're going to go through that website. Yes.
Hi, so I was wondering if you could just review the question one more time regarding the cervical ganglion damage, the right superior cervical ganglion.
Yeah, absolutely. So the question was that the first question? Or was that the?
It's towards the top.
Oh, the cervical. Yes, I'm going to pull that up during the break, that answer.
Okay,
Yes.
thank you.
Yep. I'm going to stop recording.